This year, the number of flu cases are half of what they were last year. So the question is, are COVID-19 precautions like wearing a mask and social distancing really making a dent in the numbers, or is something else going on? 25 News reporter Hallie Jones investigates.
For the second time this year, health professionals are warning us about flu season and COVID-19, two very similar viruses proven to be fatal in some cases.
We do also know that flu and COVID-19 do coexist, and we've seen that. We saw that this past spring, and we've seen that elsewhere.
The Brazos County Health District reports from October 1st to November 7th, Brazos County has seen less than half of the number of flu cases in the same time period in 2019, with only 229 cases thus far.
We expect flu to be here. It always comes. It's just a matter of when.
While we are still early into flu season, public health officials attributing the lower number of cases to much of the social behaviors adopted thanks to COVID-19.
These are all things that we have been asked to do in previous flu seasons. And so in trying to protect ourselves from COVID-19 and engaging in these behaviors, we have also managed to be able to be somewhat protective against influenza.
While mask wearing is one of the utmost important social behaviors to protect from the novel coronavirus, Dr. Clendenin says they do the same thing for influenza droplets, and it's one behavior public health officials have suggested for years to combat the transmission of influenza.
It takes all of us agreeing and working together to engage in those behaviors that will stop transmission, because until we can stop transmission, we can't stop the disease. And that works with flu or with COVID.
Dr. Clendenin says it's important to not forget how severe the flu can be even without COVID-19 concerns, looking back on the 2013-2014 flu season epidemic. She says so far the flu season highlights the importance of social behaviors for more than just COVID-19.
The flu can still be severe, and it can still lead to hospitalizations. It can still lead to fatalities. So the fact that we have been spending all our time since March hearing about good hand hygiene, wearing masks, and maintaining distance from one another, and how that's helped us seemingly reduce the number of cases of influenza we've seen this year, it's a very good thing.
Reporting in College Station, Hallie Jones, 25 News.